Greetings and welcome to the Dr. J Vlog series. It's Friday, May 2nd, 2025, and on Fridays we talk about human behavior and justifications. So last Friday I talked about the nature and the extent of the opioid crisis currently plaguing the United States and Canada. Millions of people use prescription opioids for pain relief, but many become addicted to certain opioids, and there's a huge market out there for the illegal use and abuse of various opioids. So why are they so popular? Well, opioids activate specific receptors in the body's nervous system, which leads to pain relief and feelings of well-being, relaxation, euphoria, getting a high. Prescription opioids can reduce pain and improve function and quality of life. Yet in addition to pain relief, at high enough dosages, opioids can cause drowsiness, respiratory depression, coma, and death. Other physical effects include constricted pupils, nausea, vomiting, constipation, loss of appetite, and sweating. And then long-term use can lead to physical dependence, which manifests as tolerance to the effects of the drug and then prompts people to increase their dosages to achieve the desired effects. The severity of the symptoms depends on the type of the medication that's being used or the type of opioid that's being used, the duration of the usage, how abruptly the drug was discontinued. And then those who've developed a physical dependence can also experience withdrawal symptoms and worsening pain. Withdrawal symptoms can include agitation, insomnia, muscle aches, abdominal cramping, diarrhea, and vomiting. And then those who are physically dependent also might experience cravings for the drug and, of course, have difficulty stopping usage, particularly if their pain persists or worsens. So there are a number of other adverse effects as well. You can read about these online in any number of different sources. The bottom line is that opioids have a number of different negative effects, potentially, and well beyond, of course, just managing pain and so forth. So at the end of last week's vlog, I introduced briefly the two dominant approaches to dealing with the opioid problem: the risk management and social problem approaches. So these are basically two sides of the same coin, and both approaches are needed. We have well-developed rationales for implementing both to varying degrees. I'd quibble, though, with the degree to which we tend to privilege the former approach, that is the risk-managed approach, as opposed to the latter. So again, let me explain what I'm talking about here then. Let's start with risk management. First, in the United States, there's been an average of somewhere close to 100,000 overdose deaths per year from 2020 through 2024 inclusive. So that means almost 500,000 people have died from drug overdoses over that 5-year span. The clear majority, that is well over 70%, of these deaths were due to opioids, and fentanyl being the leading cause. It's estimated that more than 2 million people in the United States currently suffered from an opioid use disorder, or OUD, while the death and addiction rates appear to be comparable in Canada, possibly even slightly higher, again, in terms of the rates. Whatever the actual numbers, clearly there's an opioid crisis in both countries, adversely affecting those who have OUD and, by extension, their families and others in their community. A great many people currently need treatment. Many desperately need help. And as with most problems, the treatment options are unfortunately those that occur much further downstream rather than dealing with the problems at their source once they start to get out of hand. In other words, we tend to take a risk management approach to dealing with the many individuals who end up having addictions. We treat people for their addictions, but we usually only do that if they choose to have to receive treatment. And it's extremely difficult then to, quote, force people to get help for their addictions. And the literature indicates that to be effective, people really need to freely choose to engage in detox and rehab to beat their addictions. So, what are the dominant treatments? Well, I've just hinted at the core issues. To deal with opioid addictions, we have to start, or almost always, with a 72-hour detox period in order to clear the opioids and any other drugs potentially from their systems. And then that's followed immediately by entry ideally into some kind of a rehab facility or program. Inpatient drug rehab, these are facilities that are designed to provide intensive, close-up treatment to individuals dealing with addictions, or again, opioid use disorders, OUDs. And so these options are essential to removing the individuals, especially not only in terms of their treatment options, but getting them out of or away from the proximal risks and the toxic environments that are fueling their addictions. So there are many different combinations of treatment options and approaches to drug rehab. No standard approach works for everyone. And so the best opioid use treatment, or OUD treatment, includes typically starting with one-to-one therapy. In other words, during these types of counseling sessions, an individual spends time with a professional who evaluates their situation to create a treatment plan recommendation. Similarly, with group therapy, the professional evaluates clients in a group context, the difference being the participants can then also collaborate and exchange feedback with other clients in typically an open, trustworthy, mutually supportive setting that allows them to ideally improve and thrive. Many addiction cases exist concurrently with other health issues or mental health issues, such as depression, anxiety, post-traumatic stress disorder, PTSD, and schizophrenia. And so mental health supports should be available to clients with co-occurring disorders in addition to their addiction treatment. Nutrition plays a vital role as well in terms of wellness and addiction recovery. Then you also have meditative practices to help relax the body and calm the mind, which can, again, often help people in recovery, and the rest of us as well, quite frankly. Yet we might consider as well massage therapy or healing touch as additional practices to promote mindfulness and relaxation. Physical activity, of course, also has many benefits and helps in the addiction recovery process. Exercise, of course, triggers the release of endorphins that relieve stress, help relaxation, and basically help to take the mind away from the addiction as well. And then we have to talk about medication to counter the medical effects. So in addition to the detox, one also might engage in opioid agonist therapy, sometimes called OAT, or medication-assisted treatments that reduce the cravings for the opioids and then prevent the severe withdrawal symptoms at the outset. In addition, the two most common medications that are used to treat opioid use disorder are methadone and buprenorphine or naltrexone. So again, that gets into the specific drugs that might help counter the effects. And then addiction, of course, impacts not only the individual, but the other folks that they have in their lives as well. So typically or ideally, you'd also have support programs for families and just in general to help them cope with the effects of the addiction on their lives. The financial cost of inpatient rehab can range anywhere from $2,500 to $20,000 per month, depending upon the nature of the program and the inpatient programs in particular, the services that are included, and various other factors. So everyone's recovery journey then will be different to a degree, requiring typically at least a few months, if not as much as potentially several years. So in sum, there are tremendous personal, emotional, familial, and economic and health costs associated with opioid use disorder. I hope to do a vlog next Friday that illustrates with a real-life situation exactly what I'm talking about and what everyone has to go through if caught up in this cycle, or for those who experience OUDs, both personally and then the implications for their families and their lives as well. Now, in general, this leads to my final point of the vlog today, the alternative or social problems approach to opioid use disorder. What if we could at least substantially reduce, if not eliminate, obviously, the risk for OUD, or the vast array of drug or alcohol addictions that afflict so many people? For example, according to the 2023 U.S. National Survey on Drug Use and Health, almost 50 million Americans aged 12 and older battled some type of substance use disorder within the past year. That's an incredible number. Almost 1 in 6 people in total. Substance use and abuse have long-standing problems and have been a plague, if you will, on our societies for decades, linked to a range of different genetic, familial, environmental, and sociocultural factors. This is not something new, and it's not something that I foresee us ever solving permanently, if you will. The problems or the risks associated with opioid use and OUD precede the birth of each cohort. It's estimated that every 15 to 25 minutes, a child's born in the US and Canada that has some type of complications related to opioid problems or the addictions of their mothers. Roughly 6 newborns per 1,000 hospital stays are diagnosed with neonatal abstinence syndrome, NAS. And that's one issue that can be addressed to a limited degree in terms of public health awareness and campaigns and programs. A recent study of young adults in recovery revealed that the most endorsed risk factors pertain to emotional neglect and abuse, followed by sexual abuse, physical abuse, and physical neglect. And so the themes that were generated from these qualitative analyses revealed challenging experiences that people had during their adolescence that included, amongst others, their unaddressed mental health needs, social and emotional needs that plagued them, and that were often reported as the main reasons for opioid initiation and continued usage. And so some of these issues then crop up relatively early on, but we don't necessarily have active interventions for dealing with unhealthy family dynamics, for example. And many times the parents are indeed the sources of the young person's early problems, but they may not have the resources themselves, and they typically don't, intellectually or emotionally and or financially, to deal with the problems and the family issues effectively. So in the extreme, then you've got the creation of toxic family situations that often lead to, again, different forms of abuse and neglect of the children, but also then puts them at much greater risk for, problems with the law, problems with subsequent substance use of various kinds, and then longer term issues such as dropping out of school and potentially addictions. There are school-based intervention programs as well, intended to educate young people about opioid risks, but I'm not sure that telling kids simply about the risk or educating them in that sense is necessarily going to get many kids to, in the infamous words of Nancy Reagan, to just say no. I'm not saying that the message is wrong. It's obviously the right message, but it's just a little bit more complicated. And more broadly, there are additional social determinants of health that can make a difference. Most important, if there's an iron rule that's associated with reducing risk, at least early on, then that would be to do everything possible to keep young people who are at high risk, to keep them in school. I know that can be a challenge. They don't necessarily want to be there, so you've got problems with truancy. They can be behaviorally disruptive in a variety of different ways, and they can manifest a variety of other problems as well. It can be quite a challenge. And so, of course, sometimes people do need special placements and treatments. But whatever the case, and whatever they might need, the single most important thing that you can do for young people, especially early in their journeys or in adolescence, and as they start experimenting or they're at risk for experimenting and using drugs, the most important thing is to keep them in school one way or another. Don't allow them to drop out. Once they do that, again, then the risks of getting in trouble with the law, ending up on the streets, and the problems with substance abuse increase exponentially. But then once they're in a more vulnerable position, we still need to try to address the risk factors in the earliest stages, like the homelessness, like their mental health and trauma issues, all of which contribute to OUD. Now, there are some other issues we can address at a more macro level. We can talk about the supply side. There are a number of considerations from a social problems perspective. We'd ideally like to be able to restrict the supply more vigorously. Again, I don't think you can ever eliminate these things, but there are obviously a great many people who are involved in narco trafficking and who make obscene amounts of money through their grow and distribution operations. They're incredibly predatory, and they don't care what the consequences are. They're just trying to make money. So that's where law enforcement, both nationally and internationally, especially if you've got international cooperation, can be extraordinarily important, at least in making a dent in the supply side of the issue. The get tough on crime philosophy, I think, makes a lot more sense if we're talking about targeting the drug cartels and the major suppliers and not the users themselves so much. We know that imprisoning the users does almost nothing to solve the problem. And furthermore, we know that jail actually just makes things worse for many people who really need treatment. Although in some cases, jail may be that final option or last option that finally prompts them to get the help that they need. So in short, with respect to law enforcement, I'm of the opinion that our enforcement efforts and prison should always target those who engage in the most predatory practices, from those who commit serious acts of violence, for example, to those who destroy lives through selling drugs or creating, harm, widespread harm to people. I mean, there are a variety of ways and mechanisms through which that can be done, including things like fraud and so forth. But again, that's another discussion for another day. But I do think we can come up with some broad agreement surrounding the indices of the most serious or extreme and widespread forms of harm. And this definitely includes those who manufacture and who profit off of addictions and opioid use disorder and so on. So in terms of medical practices, then, we can also regulate the types of opioid products that are approved for use. It's been argued by a great many people. There's a number of documentaries out there that suggest that the medical profession, or at least the corporate side of it, has profited tremendously and helped to, again, fuel the opioid crisis that plagues the United States and Canada. And so, again, in terms of medical practices, we definitely need to be extremely careful in regulating and developing abuse deterrent formulations rather than those that continue to promote long-term use and abuse. We can restrict access to these drugs via stricter regulations. We can limit or eliminate high-strength opioids and exercise much stricter control with respect to fentanyl patches. And finally, we can provide extensive education for healthcare providers in terms of responsible opioid prescriptions based on evidence-based guidelines. We could introduce physician-patient contracts to establish clear limits and treatment plans for opioid use. And we can provide safe disposal for unused opioids. Well, I'm not expecting, again, to eliminate the opioid problem or illicit drugs or alcohol problems from society altogether. But we can definitely invest more up front to help reduce the risks. I don't mean simply throwing public money at the problem. I'm talking about evidence-based research that targets the best and the most effective interventions, at least at a given time, and especially those that offer the best hope for widespread prevention of use and abuse in the first place. The worst case scenario would be to simply ignore the problems and just sort of let everyone fend for themselves. Personally, I'd rather invest more up front in terms of the systemic or the social problems approach to the opioid crisis, to focus more on prevention. But, of course, at the same time, we still have to work with the millions of people and their families who are currently dealing with addictions or OUD. So a more preventive approach, though, ideally should, in the longer term, reduce the prevalence and the incidence of the OUD over the longer term. In the short term, may you and yours continue to create peace in your lives, nurture love in your hearts, dole out hugs in abundance, and, if possible, and if you're suffering from any type of opioid use disorder, get help. Make that choice. Enter detox, and then to, if necessary, enter an inpatient treatment program. This could be the first step, or will be the first step, for your journey that will change your life forever. Until next time, you take care of yourselves. We'll see you soon.